Assalamualaikum and greetings to my fellow friends and Dr. JAYSUMAN. We are from Group 16. We'll be presenting about magnetic resonance imaging, MRI. I am Muhammad FAHMI bin FUAD and my fellow teammates are FAIHA QAISARA, BINTI AZMAN and THAM and XUAN. In this presentation, we will be presenting about introduction, background study, principles of operation, purchase consideration, conclusion, and finally reflection. Now, I will pass to Anzwan to present about the introduction.
MRI is a non-invasive method that uses radiofrequency radiation (RF) and controlled magnetic fields to create high-quality cross-sectional images of the body. It involves placing the patient inside a magnet, aligning atoms with the magnetic field, and releasing energy to construct the image by a computer. Now, I will explain to you the evolution of MRI. In 1930s, I. Rabi, a physicist, developed nuclear magnetic resonance (NMR) imaging, which measures spin and sodium movement, and became the foundation of medical MRIs. In 1940s, Philip Bloch and Edward Purcell independently studied solid and liquid magnetic resonance properties, enabling MRI scanners to use body water content for imaging. In 1950s, Purcell and Bloch won the Nobel Prize in Physics in 1955. Swedish researchers Lindström and Odeblad also studied NMR's uses, identifying differences in water and biological tissue response. In 1960s, Dr. Raymond Damadian, a physician and a scientist, hypothesized that magnetic resonance could differentiate cancer cells from non-cancerous ones. He demonstrated this with rats and developed the idea of applying NMR to medical imaging, focusing on sodium and potassium content. Damadian discovered that it is possible to distinguish between cancer cells and healthy tissue through nuclear magnetic resonance because of the differences in relaxation times between the two. From research, he proposed an MR body scanner in 1969. In 1972, Damadian filed the first MRI patent, and in 1974, designing and building the first MR machines called Indomitable and now housed in Smithsonian. On July 3, 1977, Damadian's first human NMR image, a chest cross-section of postgraduate assistant Larry Minkoff, revealed his heart, lungs, vertebrae, and musculature, forming the basis of magnetic resonance image.
Now I will discuss about the background study of magnetic resonance imaging machine. There are two types of magnetic resonance imaging machine, which are open MRI and closed MRI. Open MRI has magnet at the bottom and at the top of the machine, whereas the closed MRI is a capsule-like cavity where the magnet surrounds the patient. Open MRI is more children-friendly and suitable for large people and people with mobility issues. Patients will suffer less anxiety and claustrophobia when using open MRI. However, open MRI offers fewer image artifacts. Meanwhile, closed MRI can scan all areas of the body and diagnose more problems, offering higher quality imaging and faster scanning process. Now let's move on to the fundamental principle of MRI. MRI works on the principle of nuclear magnetic resonance, which involves the interaction of the atomic nuclei with the strong magnetic field. Energy will be absorbed when the precession frequency matches the radio frequency. The second principle is the Lambda frequency. Lambda frequency is the precession rate of the magnetic moment of the proton around the external magnetic field, and it changes according to the magnetic field experienced by the nucleus. The formula is given by angular frequency of the proton equals to the gyromagnetic ratio multiplied by the strength of the external magnetic field. Here are some applications of MRI for medical use. Breast MRI, to detect the breast cancer, particularly in people who have dense breast tissue. Functional MRI, to measure the small changes in the blood flow that occur with brain activity to evaluate the effects of stroke or other disease. Cardiac MRI calculate the patient ejection fraction, a measurement of the percentage of blood pumped out of heart each time it contracts. Hepatic MRI to show the structure of the liver as well as provide variable information about vascular disease that can affect liver. Bone or ligament MRI to detect the disc problem in the spine, bone infection and tumors of the bones and soft tissues. And lastly, perfusion MRI to visualize the tissue perfusion in the brain and other parts of the body. Now I will discuss about the advantages and limitations of the MRI. First of all, MRI is radiation-free and safe to be used because MRI will not utilize radiation. It uses magnets and radio waves and suitable for pregnant women, children, and people sensitive to radiation. We do not need to worry about the side effects like vomiting and risk of infection. MRI produces clearer pictures than other imaging techniques. It gives detailed picture of the soft tissue in the body, providing a better diagnosis of the disease. Multi-panel imaging in core panel, sagittal, and oblique, and MRI is more sensitive to tissue changes, in which it can differentiate tissue more accurately. The limitation of the MRI is it is high in cost, and it takes longer imaging time than CT scans. The picture resolution is easier affected by facial movement, and lastly, it is more in size, which can cause difficulties to fit in and claustrophobia. That's all for me, and I pass it to the next presenter.
The principles of operation for MRI. In our body, there is an abundant amount of protons that spin and create a small magnetic charge. When nuclear magnetic resonance (NMR), which is a strong magnetic field, is introduced, the proton is aligned with that field. Then the technician will introduce a radio frequency pulse (RF pulse) that disrupts the protons and force them to either 90 or 180-degree realignment with the static magnetic field. This pulse pushes the protons to go against their nature. Therefore, when the pulse is turned off, the protons realign with the strong magnetic field, releasing electromagnetic energy. The MRI then can detect this energy and differentiate tissue based on how quickly the protons release energy after the pulse is turned off. The detected signals are processed by a computer to reconstruct cross-sectional images of our body. Common problems and solution. The first common problem is MRI helium level is low. Helium is cold enough to provide the levels of superconductivity required in MRI scanner. Therefore, to solve this problem, you need to begin to refill when the helium percentage is in the 60 and have one family schedule a week or so in the 50, and when it is in the 40, it is strictly very dangerous. Next, metal objects or implants, which is a very common problem for the patients. Therefore, the technician need to remind the patient to take off the jewelry even if the patient thinks that it's not metal. Better be safe than sorry. Patients with metal implants also need to inform the doctor and technician about their medical history. Most non-ferromagnetic implants are safe, for your information. And lastly is the power outage. To solve this problem in the class 2 location, they need to do a periodically inspection on the breaker. As for the class 3, which is the MRI guided surgery, emergency power supply is very much needed, as discontinuity of power may threaten the patient's life.
What to consider when buying a new medical device? When considering the purchase of MRI system, there are several factors to be considered. First, budget. MRI systems can range in price depending on the brand, model, and features. It's important to have a clear understanding of the cost of the system and any associated expenses such as installation, maintenance, and training. 2. Clinical needs. The type of patients being treated and the specific imaging requirements should be taken into account. For example, whether the MRI system will be used for diagnostic, research, or treatment planning will affect which system is appropriate. 3. Technical requirements. The technical specification of MRI system need to be evaluated to ensure it meets the medical facilities requirement. This includes factors such as the machine's resolution, field strength, and imaging capabilities. 4. Availability of trained personnel. MRI machines require specialized training to operate and maintain. It's important to have appropriate personnel available to run and maintain the MRI system. 5. Service and support. The level of service and support provided by the manufacturer can impact the overall performance of MRI systems. It's important to assess the level of support provided, including any ongoing technical assistance and maintenance. 6. Cost of ongoing maintenance and operations. The ongoing cost of maintaining and operation the need of MRI system need to be considered. This includes cost of consumable, such as helium and power consumption, as well as any maintenance contracts. By considering these factors, healthcare organizations can make an informed decision about the purchase of MRI system and ensure it meets their specific needs and requirements. As the conclusion, MRI is a non-invasive imaging system used for diagnosing and treating oral and maxillofacial abnormalities. It provides detailed images of the internal body structures using strong magnetic fields and radio waves. MRI's effectiveness depends on factors like budget, technical requirements, clinical needs, trained personnel, manufacturer support, and maintenance costs. Advances in 3D imaging and in dynamic scanning will further enhance its use. MRIs is a valuable tool for medical diagnosis, research, and treatment planning.
On to the last part, reflection. Magnetic resonance imaging has bring many advancements to the imaging technique by providing detailed, non-invasive, and resourceful diagnostic information to our medical history. Next, during the design of process of MRI, cost accessibility, space requirement, patient comfortability, magnetic field strength should be considered as a very important design process as it will affect the picture produced by the MRI. And last but not least, further improvement like higher magnetic field strength and development of more contrast agent can be implemented to improve the diagnostic accuracy of the MRI. These are references that we use for our presentation. We would like to express our gratitude towards them. Thank you for watching our presentation. We will proceed to the Q&A session now.